Hi, my name is Dr. Sunny Cheung, and I'm an orthopedic surgeon specializing in shoulder, hip, and knee surgeries at NewportCare. Well, it depends. If you are relatively healthy, you're using a walker for about 6 weeks, then a cane for another 6 weeks, usually you're walking reasonably well at 3 months. But some people who are pretty fit and young can recover faster than that. Well, again, depends on how fit you are. So elite athletes can be walking at 4 weeks, can be running at 4 months, and back to contact sports in 6 months. But if you're a pretty good athlete, then maybe 9 months for contact sports. And if you're like a recreational person, regular person, it may take up to 12 months to be back to sports. Well, it depends what kind of meniscus repair it is. If it's just trimming the meniscus, you could be back to sports by 6 weeks. But if it involves suturing and repairing the meniscus, then it could be up to 4 months to be back to jogging and another 6 months to be back to sports. So traditionally in the United States, most surgeons have done it in a posterior approach, which works fine, but there's a little bit higher dislocation risk. I've switched over and I do it anterior hip, which means it's a smaller incision, less chance for dislocation, and it's more muscle sparing, so it's a faster rehab. Well, probably the most important thing is to stay fit and healthy, and you don't want to be overweight. I see that there are a lot of younger people they're in good shape and they have bad arthritis, but they feel fine because they're not heavy. But if you're overweight, then that's probably going to make your knee arthritis a lot worse. Well, a knee replacement actually is resurfacing the knee with a metal layer and a plastic insert and another metal layer. However, if you have just a spot defect in your knee, you might be able to do like a cartilage graft on it.